Hi, my name is Janelle Gibson. I'm a physical therapist, and we are here at the University Orthopedic Center. I'm going to be talking to you a little bit today about the pelvic floor.
Janelle, after a woman has a baby, what changes might she experience in her pelvic floor?
So in clinic, women will often describe just a change in sensation or a feeling of looseness within the pelvic floor after vaginal delivery. We know from the research that during the second stage of labor, the pelvic floor and the pelvic ligaments undergo a lot of stretching. A healthy pelvic floor can tolerate this stretching really well. But there is risk for injury there. Secondly, we know that a lot of women have tearing that occurs. That tearing might occur naturally, or the doctor may perform an episiotomy if they need to during vaginal delivery. So I'm going to go ahead and show you where typically tearing or an episiotomy occurs on the model. We're going to look down at the base of the pelvis at the pelvic floor specifically, and we're looking at that first layer. So sit bones here, pubic bone, tailbone. Between the two openings, we have the vaginal opening here and the anus. There's a piece of tissue here called the perineal body. And usually when tearing occurs, it occurs through this area of the pelvic floor. The pelvic floor muscles need time to heal after vaginal delivery. So on the most basic level, tissue heals at about 6 to 8 weeks, depending on the extent of the injury. And those muscles need to rest.
Is there anything that increases the risk of injury?
Yes, so we know from the research that use of instrumentation, specifically the use of forceps during vaginal deliveries, can increase the risk of and severity of muscle injuries within the pelvic floor.
When should a new mother go see a pelvic floor physical therapist?
That's a great question. So it depends on the woman. Typically, a woman needs to follow up with her physician at that 6-week follow-up to make sure everything's healing well, like we talked about a little bit earlier. In order to see a pelvic floor physical therapist, signs that a woman might want to recommend or ask for a referral to see a pelvic floor physical therapist at her follow-up would be signs of pelvic floor dysfunction. So we're going to go through what those different signs would be. So first and foremost, a lot of women will experience urinary leakage, bowel leakage, painful intercourse, symptoms of prolapse, so symptoms of heaviness within the pelvic floor, or feeling like there's something falling into the vaginal canal. Constipation can be a sign of pelvic floor dysfunction, as well as urgency and frequency, where you might feel like you're going to the bathroom way more often than you used to. And then in addition to that, tailbone pain, any form of pain within that same region that we talked about earlier would be good signs to go see a pelvic floor physical therapist.
What happens to a woman's pelvic floor as she grows older or has more children?
So as we age, a lot of things change. We have hormonal changes that occur, and those hormonal changes can impact our pelvis and our pelvic floor. So as an example, we have changes within our connective tissue, specifically called the elastin and collagen. And so a really easy to understand example of those changes would be wrinkles, or as we notice, our skin starts to sag a little bit more. It's not quite as supple as it used to be. The same kind of things can happen within the pelvic ligaments, where they're not as supportive. In addition to that, because of the hormonal changes, our muscles also weaken a little bit. And so with the pelvic floor, that same thing can happen, where because that secondary structure, that pelvic floor, isn't as supportive, a woman might be more at risk for developing pelvic floor dysfunction as she ages. With having more children, there's an increased risk for pelvic floor disorders. One in particular is pelvic organ prolapse. Pelvic organ prolapse is a condition in which the pelvic floor muscles and ligaments no longer provide enough support for the bladder, the uterus, or the rectum. There's more detail on this condition, as well as videos on the condition, on the web at voicesforpfd.org.